welcome everyone, and thank you for joining today's Connect and Explore webinar. I'm Todd Phillips of FHI 360. I'm the director of the Coordinating Center for the National Collaborative on Childhood Obesity Research, known as NCORE. Today's program will include a spotlight session on first findings from USDA's Food Acquisition and Purchase Survey, or FoodAPS. We'll be connecting you to researchers who will share key findings from the just-released report, Where Do Americans Shop for Food and How Do They Get There? Findings from FoodAPS. We'll hope you'll learn a lot about FoodAPS data availability and how you can take advantage of the FoodAPS data set. After the presentation, we'll have a one-on-one panel where you can ask our presenters questions. Throughout the webinar, if you have questions for our speakers, please write it in the chat box to the left of your screen, right where you see the large white arrow. Also, if you need technical assistance during today's webinar, please let us know using the same chat box. If you have trouble logging on to the webinar but you can hear us on the phone, please email us at ncore@fhi360.org, and we'll work with you to resolve the problem and get you on the webinar. And finally, one more important technical note. If you've decided to listen to our webinar today using your computer speakers, please turn down and mute your computer microphone. This will greatly reduce the potential for background noise. Thanks. We'll also be live tweeting during today's webinar. If you're on Twitter or other social media, we encourage you to join the conversation by using hashtag ConnectExplorer. All right, so getting started, our speakers today are Jessica Todd and Mark Denbali, researchers who have been heavily involved in FoodAPS. Jessica is a research agricultural economist focusing on diet, safety, and health economics. Mark Denbali is a deputy director for data. Both are from the Food Economics Division at the Economic Research Service at USDA. One last thing before we get started. Please know that the views expressed are those of the authors and may not be attributed to the Economic Research Service or the U.S. Department of Agriculture. They also do not necessarily reflect the views of NCORE or its funders. With that, I'd like to turn it over to our first presenter, Jessica Todd, who will provide an outline for today's webinar.
Thank you, Todd. Welcome, everybody. Thanks for joining us today. I have three main topics to discuss with you. First of all, I will provide a short overview of the FoodAPS survey. Some of you might be very familiar with the survey and others less so, so I want to bring everybody up to speed on that. I'm also going to present a brief summary of the first findings that were published in the report last Monday, and also I will describe how to access the data for those of you that might want to dive into the nitty-gritty. But first, before we begin, we'd like to open with a brief poll. To the left of your screen, above your name, you will notice a button with the letter A in it, like the one shown here. Move your cursor over this button to see the drop-down and then click to select your response. Okay, let's begin. Our poll question is, how familiar are you with using food purchase data in your research? Please select A, very familiar, B, somewhat familiar, or C, not familiar, from the drop-down on the left of your screen. We'll give everyone about 30 seconds to respond. Okay, let's see the results. It appears that we're about evenly split between somewhat familiar and not familiar, with a few of you very familiar. So those of you very familiar will probably know a lot of this, and we'll catch everybody up with this presentation. So to begin with our overview of the FoodAPS survey, some accounting, I guess, or some big picture ideas. It was jointly sponsored by the Economic Research Service and the Food and Nutrition Service. And it was designed in consultation with distinguished academics, government leaders, and experts, with the overall goal to expand possibilities for research on food choices. And so in the design, you'll see many of the choices were to really target both the funding agencies and the research interests, specifically to fill in gaps or to dive more deeply into food choice research. These are the types of questions that the survey was designed to ask, to address, focusing on not only the overall picture of household food consumption and food choices, but also the picture of SNAP households in comparison to similar non-SNAP households and food insecure households, And we really wanted to understand more about the prices that households pay and whether the value of SNAP benefits was enough to purchase the thrifty food plans in various areas. To help meet these research goals, the FoodAPS sample is not only nationally representative, but it's also representative of 4 specific groups: SNAP participants, and then non-participants in 3 income groups: those at or below the poverty line, those just above the poverty line but less than 185% of that poverty line, and greater than or equal to 185%. And to do this, the survey had to oversample both SNAP participants and low-income non-participants. The next thing I want to show you is a little figure of the data collection overview. And this is a very simplistic summary of how the data were collected. The data collection was complex and multifaceted. But it began with an initial in-person interview, and a lot of detailed information was collected. And then the household was asked to report all acquisitions over the course of 7 days, and they used their handheld scanner and food booklets. And then they also called 3 times during the week to report their acquisitions. The survey wrapped up with another in-person interview at the end of the week, and the interviewer collected all of these materials that the household used to record information. The information about food acquisitions that was collected included both at-home and away-from-home acquisitions. So grocery purchases or anything that was brought into the home for preparation at home, as well as any foods that were consumed away from home or purchased away from home, and also things that were acquired at no cost, such as foods from schools, food pantries, gardens, family members, etc. And households were asked to record not only where the food was obtained, but by whom and how much was purchased and how much they spent. The other information collected in the survey was detailed household and individual level information, things such as the primary food store, why they chose that food store for their main grocery shopping, how they usually got there, their household expenses, participation in other food assistance programs in addition to SNAP, and individual characteristics like income, body size, allergies, school enrollment, school meals. And a unique feature of this data is that it was enriched with extant data. So locations of food stores and restaurants, food prices, food-related school and community characteristics, other area-based measures, and program administrative data were all linked to this survey. This is a reminder that if you have any questions during the program, to type them into the chat box down here, and we will address them in the program or at the end of the presentation. And next, we'll move on to the summary of these first findings. And they were published in this report. I show the cover here, and it's a really long title. And because the survey collected a lot of detailed information about where people shop and when they shop, this report is only about where they usually shop. So they reported this in the household interview survey. And so in this report, we looked at their usual travel mode to get to their main store, the type of store that was, and how far it was from the household, and also compare that to the distance to the nearest SNAP-authorized supercenter or supermarket. So what did we learn? We learned that most households drive their own vehicle to do their regular food shopping, nearly 88%. Okay? And this, among SNAP participants and poor non-participants, the rate is much lower, about 68 or 65%. And we also noted that poor non-SNAP participants were not different from SNAP participants in their use of different transportation modes to get to their main store. However, higher income, so those above poverty, non-participants, were different from SNAP participants. And this bar graph shows you those different allocations. The red shows you whether they used someone else's card to get to the store, and the green whether they used some other mode of transportation, including walking, biking, public transportation. We also compared food-secure households to food-insecure households. And what we notice is that food insecure households are less likely to use their own car than food secure households, and they're more likely to rely on someone else's car or to use an alternate mode of transportation to get to their main store. Next, we looked at the types of stores that households identified as their primary store. And despite the differences in transportation to get to the store, the type of store that they used for their main grocery shopping didn't differ across the different household types we compared. 90% of SNAP participants and poor non-participants do their usual food shopping at a supermarket or supercenter. And this is similar to higher income non-participants. The big question is why? Why are the store types the same despite the different modes of transportation? Well, on average, households don't go to their closest supermarket or superstore. In fact, all households tend to shop around. When we compared the distance to the nearest SNAP-authorized supercenter or supermarket, and that would be the blue bars, to the distance to their primary store, we can see that all households travel further than their nearest store. Okay, we compare this graph shows all households, SNAP participants, WIC participants, and food insecure households. And while the nearest store is about 2 miles for all these household types, all the households travel at least a mile more. We also looked by travel mode. So even those that walk or use public transportation or rely on someone else, they still travel further to their primary store than their nearest store. So this first column shows the distance to the nearest SNAP-authorized supermarket or supercenter, while the last column shows the distance to the primary store. And you can see in all cases, whether they use their own vehicle, someone else's vehicle, or alternate transportation mode, they all travel further to get to their main store. And that wraps up the first findings here. Again, I'll remind everybody to hand in their questions if you have any. Now, finally, I want to summarize how you can get access to the data and what is available now. Because FoodAPS contains so much detailed information about respondents, the data are not currently released to the public in order to protect respondent confidentiality. And what we mean by release to the public is that they're not available on a public website, just easily downloadable and for use on your desktop machine. Instead, they're posted to a secure enclave at the National Opinion Research Center, also known as NORC. And to gain access, users must sign a pledge of confidentiality, known as SIPC, and be subject to the Act's penalties. You also agree that you will not disseminate any research results based on FoodAPS data until it has been reviewed and cleared as having no risk of disclosure of the respondents. And there's many detailed instructions about how to gain access available on the FoodAPS website. You'll have a link to that site at the end of the presentation. So what are available now? Well, we like to call this our primary data, which is all of the data collected directly during the survey. And most of this data is available already. And this includes the household and individual sociodemographics and other information collected during the interviews. Also information from the meals and snacks form, which was left at the household during the week. And it indicates which meal or snack each individual ate each day of the reporting week. It does not include what they ate, only if they ate a meal or a snack. We also have the acquisition event and item data. The food away from home item data are not yet posted, but will be soon. Event data includes the place name, the type of establishment, the amount spent, the forms of payment used, and who acquired. Anything at the event level. The item data includes details on the items obtained at each event, including descriptions of each item, expenditures, the quantity purchased. For some things, it's the weight or the package size, and other item-level details such as that. We also have some constructed data already posted. This includes the food environment data, which were used in this first report. These data measure the distance to the nearest retail stores and restaurants, and a number of stores and restaurants within specific radius. The food at home and food away from home nutrient data for items are still under construction. The goal is to have each item matched to a USDA food code that includes nutrients and food pattern equivalence data, with some exceptions. We also will have average food prices around the households, and this is still under construction. And we'll have data that includes income imputations when there was missing income reported, measures of SNAP eligibility. So for more information, you can go to our main webpage. Here you'll see information about the survey instruments and other documents. You can download those and read those in depth. So there is also a list of the data sets that are posted at NORC and the specific variables and their definitions. There's details about how to gain access to the data through NORC, and also a list of currently funded external research. Our list of data sets and variables are updated each time new data are posted or updated at NORC. And with that, I'll turn it back over to Todd with NCORE.
Great, Jessica, thanks so much. Such interesting information. I know it's going to be, data set's going to provide a lot of insights for the field. So for this segment, we're going to move on to our one-on-one portion of the webinar today. And at this point, we're going to be joined by Mark Denbali. As I mentioned earlier in the program, Mark has been working closely with the FoodAPS data, and he's Deputy Director for Data within the Food Economics Division. And like Jessica, he's with ERS. So welcome, Mark, to the webinar.
Thank you very much for joining us today.
So we have a couple questions we want to start with, and I think folks saw we have a number of questions that were asked today during the chat. We'll try to get to as many of them as we can. But the first one we wanted you to answer for the group today are, what new analyses do we expect to be able to tackle with FoodAPS that we couldn't before?
The main thing that people should focus on is that we have never had access to what Americans buy, the item level information in terms of food. This is the very prime first survey of its kind that provides detail on what Americans buy, where they buy it, and why they buy it across a class of income group, whether they're participants in SNAP, WIC program, or whether they are low-income, eligible but choose not to participate, and higher-income people. That's the core of the survey that enables a whole host of new questions to be addressed. For example, do the basket of foods that SNAP participants purchase cost more or less than the rest of the population or the comparable population? Do SNAP population participants have access to healthy foods? What are the kind of price distributions that they face around them? And what goes into choices they make in terms of availability and access to stores?
Thanks for that answer. And that leads us into our next poll that we want to do, which is around what types of analyses would be most useful for those of you on the phone for your work. And if you remember, you just go to the letter A up above your name, and when you hover over that, you'll be given the choices of A, B, C, or none. And so the question we're going to ask is, what research topics or questions would you like to see tackled first using FoodAPS? Answer A for relationship between food assistance programs, food security, and diet quality. B for factors that influence the prices paid for food. C, proximity to food stores and restaurants and the quality of the acquired food. So take a next 30 seconds and go ahead and choose your responses. All right, it looks like the voting's slowing down, so why don't we move ahead to the results. It looks like A was the clear winner, so sounds like folks on the webinar are most interested in hearing about relationships between food assistance programs, food security, and diet quality as one of the next study questions. So moving on to our next question for you, Mark. We know that individuals can apply for grants to work with the FoodAPS data. So can you provide more details about the grants and that process?
Absolutely. We have a series of opportunities. The first one was announced last year through University of Kentucky Center for Poverty Research. There were some 60 very excellent proposals submitted. 12 was selected. There will be a workshop of the results of these presented here in DC area fall of 2016, and simultaneously right around that time we will announce the next series of grant proposals through University of Kentucky, and we are working on more of opportunities down the road.
All right, awesome. We had, if folks could see, we had a number of questions from the audience. So Jessica and Mark, I'm going to present some of those to you, and I know you'll answer them to the best of your ability today, knowing some we may have to get back to folks. So one of the first questions was around how the study participants were selected.
This is a random sample of these populations. The very interesting dimension of this survey and a uniqueness of it is that it links up to the administrative records, something that hasn't been done before. So we took the United States Postal Service delivery address and matched it up to SNAP addresses and created two distinct populations of those who participated in a SNAP program and those who didn't. And from those two frames, we drew random samples which happened to fall into 27 states. I can't provide further information how we did that more specifically because it would risk disclosure identification.
Great, thank you. And Jessica, we had a number of questions about transportation data. One of the first was around how a primary store was defined.
Sure, I'd be happy to clarify that. In the first interview that the household responded to, they were specifically asked what store they go to do their main grocery shopping. And so the interviewer was assisted with a pre-populated list of stores near the household, and the household could select a specific location or fill in something that wasn't on the list. And from that, we were able to geocode all but 317 households' primary stores, which were linked to the SNAP store database and also our other retail databases. And so we were able to identify that, but it was defined as what they identified as their main grocery shopping store.
Great, thank you. One other question we had was, is the data only at the national level, or is it able to do some geographic breakdowns and analyses?
So the data are nationally representative and then of the subpopulations that I spoke of. However, the data, the capabilities to link households to very local information is available, but there's limited capability to do local area estimates. So regions might be distinguishable, but it really isn't suitable for an analysis of a specific market location.
Okay, thank you. In terms of back to your transportation data, was mode of transportation adjusted for car ownership or the availability of public transportation?
Thank you. No, we did not make any adjustments for that. We just used the household's report of how they usually got to a store.
Great. And did you notice, or are you going to look at any urban versus rural differences in terms of transportation?
Those are in our plans. I know that we have researchers working on an access-related report, but I can't answer any specifics about what the report includes at this time.
Thanks. One other question that we received was around how this data set is different from IRI or Nielsen data that's available.
Right. Thank you for that question. I think it's a great one that will help users understand the features of this. So Nielsen, which is now also IRI or similar to IRI data, collects only food-at-home purchases, so only from retail food stores. It does not collect any food away from home purchases. So FoodAPS is unique in that we have both food at home and food away from home acquisitions by the same household among all household members over an entire week. Not only that, is we have acquisitions that were obtained at no cost from food pantries, from own gardens, hunting and gathering, or other types of acquisitions that wouldn't be captured from any other measure of food away from home purchases or food at home purchases.
Great. Were there any questions you saw that you would like to jump in and answer?
I would just add to a good point Jessica had on the differences between IRI and Nielsen, is that here what we have done is we have painted a excellent picture of the food environment that the households we obtain information from live in, and are going back to a question asked before, what sort of research questions can you address with these data, is what we are looking for is what drivers are behind people's choices that they're making, and we think food environment is quite important, and food access and access to availability of food, price distributions around where people live. And Nielsen and IRI are not exactly focusing on that dimension as we do.
Todd, I saw a question asking for clarification on some of the research findings. Can I back up to show the slide that gives the information? So somebody asked, was the primary store usually perhaps modally also a supercenter or supermarket? And I will go back to the research findings that shows this. But yes, in fact, 90% of households identify a supermarket or a supercenter as their primary store. And that was similar, so it's among SNAP participants or higher income non-participants. Really all households are shopping primarily for their main grocery shopping at supermarkets or supercenters. So I just want to highlight that that's where that was, and it is in the report. And then there was a question about WIC. Yes, it is. WIC participation appears to be underreported in the data. Would it be possible for you to link WIC administrative records as you did for SNAP? And I am not certain about that, but we are going to look at the WIC participation and WIC purchases in more depth in the future. That I know that there's a research team looking at that. But it wasn't a target group for the sampling design. So that is something that could be worked on a bit more in the future. But I don't know about linking it to administrative records.
Currently what we have is details on SNAP, and the sampling frame took advantage of that participation in that program. That did not happen for WIC. Having said that, if someone has access to WIC, we did ask our participants whether what they purchased, whether it was related to WIC or not. We know that information, and so if someone has access to administrative WIC data on that household, certainly could be linked up. Just leave it at that.
All right, great. Any other questions that you saw or final comments you'd like to make today?
Yes, I did skip over my contact information slide. I apologize for that. But on the slides that will be attached, I want to just let you know that we're always happy to hear from you. So the FoodAPS webpage has email contacts, and please don't hesitate to contact us with questions.
Yeah, our contact information is on one of the slides. It will be there. Please contact me. with any questions you have.
Great. Well, thank you, Jessica and Mark, so much for the great presentations, for answering the questions. A great discussion, and we can tell it's going to be a great resource for the field in answering questions that affect obesity. Next, I'd like to share an upcoming event that may be of interest to those of you on the webinar today. NCOR is going to be attending the Society of Behavioral Medicine annual meeting and scientific sessions just a few weeks from now on April 22nd to the 25th. We'll be there in 3 different ways. First, we'll be co-hosting the NIH mHealth Training Institute. So those of you who are attending SBM, please consider signing up for that Ancillary Training Institute. We'll also be hosting one of the presidential roundtables, where we'll be telling a little bit about NCOR and our research agenda, and get your thoughts on issues that NCOR funders should be considering and looking at going forward. And then lastly, we'll be in the exhibit hall, where if you want to pick up some information about NCOR or ask some questions or learn more, you can come see us at the exhibit hall. Lastly, if you have further questions, you can always email the NCOR Coordinating Center at ncor@fhi360.org. And just before we wrap up, we've got a lot of questions about availability of the webinar and the slides. And I do want to note that on ncor.org, if you go under the Resources tab, then to NCOR Resources and NCOR Webinars, you'll find that this webinar and past ones are archived there, so you're able to view them and have access to the slides. And you can always stay connected to NCOR by following us on Twitter and LinkedIn, visiting our NCOR blog, and signing up for our monthly e-newsletter. So with that, I want to thank all of our guest speakers again today and everyone who signed in.